Hello everyone, we're here today at the EULAR 2026 Congress in London. My name is Wendy Wagenaar, I'm a patient research partner from the Netherlands.
And my name is Alvaro Gomez. I'm a postdoctoral researcher at the Karolinska Institute in Sweden. And we have the delight to be joined by Dr. Elena Nikiphorou, a consultant rheumatologist from King's College Hospital here in London. Thank you for joining us today, Elena.
Thank you very much for having me, and welcome to our sunny, summery city.
Yes, definitely. So, Elena, your presentation will focus on the RA paradigm shift. To start off with, can you tell us a bit more about this paradigm shift that is happening and also, of course, what it means for patients?
Absolutely, thank you. So the RA paradigm shift that I'll be talking about on Saturday is essentially the story of RA and how it's evolved over the years. It's an extraordinary story of remarkable success in the journey of the person living with RA, how we came to be treating people living with RA, changes in the treatment approaches, but also greater insights as our understanding of disease evolved around the importance of more comprehensively managing our patients.
Okay, thank you for sharing that.
And despite all the story of success, we still have challenges in treating patients with rheumatoid arthritis today. And one of these is the so-called difficult to treat disease, so patients that experience symptoms even though they receive the recommended therapies. So how common it is to have difficult to treat disease and what is driving these patients' symptoms?
You're absolutely right, and that will be one of the key objectives of the session to touch on difficult to treat disease. And you ask how common it is. And the prevalence is actually quite, the range is wide. It's been reported from anything from 5 to 30% globally. And I think it's because it involves different populations, geographical differences, the way the definition was used. So there's a bit of a range when it comes to how frequent, how common it is. But it is indeed one of the key challenges currently in the treatment paradigm of RA, understanding why some people will continue to cycle or switch between different treatments, but they still are not able to achieve the desired treatment outcome. So it's a really important concept to understand, and it's also really important to understand the factors that lead to difficult to treat disease.
And if we focus on the updates on difficult to treat disease, so what have we learned during the recent years on how to manage patients with a difficult to treat disease?
So we defined difficult to treat disease in 2021. The definition has been out, as you probably know, for about 5 years now. And then we wrote points to consider on the management of difficult to treat disease. And in that management algorithm, there's several important steps, I would say. First of all, we ask the clinicians dealing with patients with difficult to treat disease to take a pause and rethink the diagnosis to ensure that they are actually dealing with, first of all, rheumatoid arthritis and not another comorbidity, for example, or condition that may be mimicking rheumatoid arthritis. And this is where we are also prompted as clinicians to think about comorbidities such as fibromyalgia and other pain syndromes, obesity. As we know, these two comorbidities can challenge the accurate assessment of disease activity in patients, leading to inappropriate estimations of disease activity. So we are prompted in our management to stop and think, reassess, understand what we are dealing with, to use biomarkers such as imaging, for example, to look for objective evidence of inflammation, if there is any doubt for subclinical disease. And if we do not see inflammatory disease as a driver of symptoms, to then take a different approach to management, which touches on patient education, health literacy, and self-management. So if I may summarize all of what I've said, it really, this concept of difficult to treat encourages us or forces even a pause on the traditional approach to the management of RA, which would include a very rapid escalation of treatment.
Thank you for sharing that. Very good summary as well. Thank you. As a final question, looking ahead, what excites you most about the future of RA treatments in the upcoming years?
You know, I think the story of RA and its paradigm shift will remain probably one of the most remarkable success stories in history. And I think what excites me a lot is this idea of an even earlier window of opportunity to intervene, even earlier than what we've known it to be, intervening even before arthritis sets in patients who are people who are not even patients yet, people who are at high risk of developing RA, intervening with treatments and trying to stop the progression of disease. But at the same time, I wonder whether the next sort of big discovery may not be a cytokine as such, but a whole ecosystem. The gut microbiome, that's getting a lot of attention, and perhaps, we need to be targeting that in influencing both disease expression in the first place, but also disease progression. Lots of excitement.
Definitely very cool, and also very cool new development research area to look into, I think. Thank you very much for answering all of our questions and for sharing your insights, Elena.
Thank you for having me. It's always a pleasure to speak with you.
Yes, thank you.
Thank you, Elena. And thank you also for joining us for this interview, and see you around in the venue.